Thank you, Natasha. Hello, everyone, and thank you for attending this month's wellness webinar. My name is Marina Mulvey, and I'm the Doctor of Audiology here at Barton's ENT and Audiology Clinic. Today, we're going to discuss taking care of your hearing and how hearing loss prevention leads to better health. So, this is a brief outline of our talk. And just kind of shows that where we're going today. And I'll share how prevalent hearing loss is in our country. I'll share with you some compelling numbers of other health conditions related to hearing loss. And then we'll discuss the pervasive influence of noise exposure on hearing. We'll cover the care of your hearing by prevention, and finally, the action steps you can take every day and today, of course, to take care of your hearing. So some of my background, oops, I'm sorry, I clicked the wrong thing. There we go. Here's a little bit about my education and professional background. I'm originally from San Jose, California. I have a bachelor's and a master's in audiology and communication disorders from San Jose State University. I received my doctorate through the University of Florida. And my husband and I owned a private practice of audiology and hearing aids in Santa Rosa and ran that for 18 years. We moved to Tahoe in December of 2019, and because the mountains were calling, and we came. And I've been the doctor of audiology since December of 2019, so a little over 4 years now. So the statistics of hearing loss in the US. So these are certainly eye-opening statistics of the prevalence. The National Institute of Health did a survey of people 12 years and older over a 10-year period. And from their survey, they extrapolated that over 38 million people have some degree of hearing loss. And a majority of them presented with mild hearing loss. Then the prevalence became less as the degree of hearing became more significant. Mild hearing loss may not sound serious, but it can have a significant impact upon the quality of life in the areas of education and occupation, as well as social interactions, and it can have an emotional impact on relationships. So since we're talking about how prevalent mild hearing loss is even in 12-year-olds, but on up, of course, I just wanted to talk about some of the signs and effects of mild hearing loss. So sometimes ears can feel plugged up, sounds like people are mumbling. The website Verywell Health describes it well, and some of these descriptions are what patients tell me their primary concerns are when they're referred for hearing exams. So they come in, speech is loud enough to hear but not clear. They have difficulty hearing at distances, and especially in noise. And we all have more of a difficulty hearing in noise, but some people can just kind of float through that easier than others. It takes more effort to listen, leading to fatigue. And they're expending more effort to hear and listen, which can lead to fatigue and headaches at the end of the day. And people with mild hearing loss may tune out due to the difficulty to understand conversations. Children with mild hearing loss have the same challenges, but may have limited resources to communicate what's going on. So some signs may be that they appear not to be paying attention in class or choosing to ignore their parents. At home, and especially in the classroom, mild hearing loss can be misinterpreted as the child having behavior issues or possibly attention deficit issues. So hearing loss is correlated with many chronic conditions, and this graphic and information is from the American Speech Language and Hearing Association. Hearing loss itself can have harmful effects on our health and well-being. Comorbidities are defined as the presence of 2 or more diseases or medical conditions in a patient at the same time. In the top box of this image, you can see the risk factors that can potentially lead to developing or worsening hearing loss. Diabetics, for instance, are twice as likely to have hearing loss as their hearing peers. The box at the bottom of the image shows some potential consequences of hearing loss. People with hearing loss are more likely to fall, which increases the risk of hospitalizations. And as more people are becoming aware, there is a connection between hearing loss and cognitive decline or brain atrophy. In fact, that has been the primary reason that several of my patients have come into my clinic for hearing exams. And on to cognitive decline and hearing loss. So a quick note about that, about how and why that works. So I love the quote by Waring, the Waring study that's cited at the bottom of the slide. Age-related hearing loss is the largest modifiable risk factor for cognitive decline and dementia. Complete elimination of hearing loss would be expected to reduce the incidence of dementia by about 8%. And that's a pretty significant number in a dream environment where hearing loss did not exist. And what they're saying about modifiable is that it's treatable. It's something that can be medically or audiologically assisted. So whether it's through treatments that are for hearing loss that are caused by a medical situation that can be looked at by an ear, nose, and throat physician and treated, or whether it's hearing loss that is not treatable but can be assisted with hearing aids. So worse hearing was associated with steeper declines in cognitive performance over time. And the risks for cognitive decline can begin early with hearing loss. So hearing loss leads to compromised speech perception, and the greater communication effort leads to reduced social engagement, as we kind of mentioned earlier. And impaired cognition comes from, the isolation, depression, because they're not being as social anymore, and just the lack of stimulation of the inner ear and hearing nerve. And the early risk factors, going back to the bottom sentence on the slide, the early risk factors of hearing impairment for cognitive decline may lie beyond the traditional test methods utilized in the clinics for the purposes of communication frequencies. And we will discuss the range of hearing in a couple of slides. Okay, so hearing loss and healthcare utilization. So over 10 years, Nicholas Reed and his associates presented this study that they did at Johns Hopkins University. And these numbers show the mean difference in total healthcare costs among persons with untreated hearing loss versus those without hearing loss. So untreated hearing loss being people that didn't have any connection with a hearing care provider, such as an audiologist, an ENT, or an otologist. These untreated hearing losses they also were not hearing aid users. So these are people that are just letting it go and not doing anything about their hearing. And so they have 17% increased risk of emergency department visits, 44% increased risk of 30 days readmission. So they're going back into the hospital after being hospitalized in the first place for 2.5 days longer are their hospital stays, and then 47% increased rate of hospitalization. So we're just seeing a lot of stress upon the hospital and healthcare systems due to untreated hearing loss, people who are doing nothing about it. The higher costs were associated with people who didn't get help for their hearing loss from some sort of hearing care professional, and they definitely were not hearing aid users. People with untreated hearing loss had more emergency room visits and higher rates of readmission, longer hospital stays, as well as significantly greater rate of hospitalizations, as you can see with these numbers. And these statistics add up to increased healthcare costs, which will be very clear in the next slide. So these numbers were also presented by the Reed et al. Study from Johns Hopkins. And the persons with, again, untreated hearing loss had healthcare costs greater than those people without hearing loss. And untreated hearing loss costs insurance companies, healthcare programs, and patients a significant amount of money. This study also noted that people who used hearing aids and were under the care of a hearing care professional had similar numbers to those without hearing loss. As in so many facets of self-care and being proactive about your health, early intervention is great and prevention is key. So this difference, people talk about how expensive hearing aids are, but over a 2-year period, the people who used hearing aids or without hearing loss have a $3,800 less healthcare costs, so they could put that toward their hearing aids. Pretty good ones too. Okay, on this slide. So now we're going to be dipping the toe or more, might be diving into noise. It's a very important thing to understand the effects of noise on our hearing. And noise is the most common cause of acquired hearing loss, and it accounts for over 25% of people affected by hearing loss. And our exposure to noise is one of those things we actually have control over, like we were talking about, the modifiable risks. In most cases, we can avoid it or just turn down the volume, remove ourselves from it, and protect our ears. Like this little boy is in that picture. He's trying to. A normal, healthy human inner ear, or cochlea, which is the sense organ of hearing, has the range of 20,000 hertz, which is over here, all the way up to, 20 hertz, all the way, which is a very low pitch, and 20,000 hertz. So this is as if we took that little snail-shaped organ of the cochlea, the inner ear, and stretched it out, flattened it out on a line. So there's very low pitches that the human ear is able to hear and very high pitches that the human ear is able to hear. From the time our cochlea is formed in the womb at about 18 weeks, all the way to present day, there are effects upon our hearing. Of course, noise, certain medications, high fevers, certain health conditions, heredity, and aging can all affect our hearing. And of course, our heredity is we have familial history of hearing loss that we have no control over, and some people are born with hearing loss, of course, that they had no control over. The impact of these life factors first makes its effect upon the highest frequencies, so out here. So the highest pitches are the ones that are affected and, as I always say, pounded upon by especially noise, but the other effects of life, because they're more external in the way the cochlea is shaped. And then that gradually makes its way down the frequency spectrum, and our communication begins to be affected once it starts affecting the levels at 8,000 hertz and below. And this is where we start measuring hearing in the clinic. So this is what we call the clinical, or anybody who has hearing loss in this range is clinical hearing loss. So it starts to be affected at these levels, so 8,000 hertz and below, where all the sounds of speech reside. So from vowel sounds on the lower end, all the way up to the highest consonant sounds on the high end. However, well before it affects communication and hearing loss, one of the primary warning signs of hearing damage is tinnitus. That's the ringing in the ears, any kind of sound like that. When the part of the cochlea called the hair cells are damaged, tinnitus can begin and be the first signs that we're losing our hearing. So now let's talk a little bit about tinnitus. So, okay, hold on. I just have to get back to my notes here. There we go. So the definition of tinnitus is the perception of sound that does not have an external source, so other people can't hear it. And according to the American Tinnitus Association, approximately 25 million Americans, or about 10% of the adult population, experience tinnitus in any given year. So sometimes it's constant, sometimes it's just comes and goes. For a lot of even children that I've asked about tinnitus, they all say, yeah, it kind of comes on and rings for 5 seconds and then it goes away. So even children can have tinnitus, and it doesn't mean that they're getting hearing loss necessarily. Um, I just, for a lot of patients, I tell them that it's a sound that our body makes, like with our knuckles popping or our stomach growling. But it also can be a warning sign, and especially when it is constant. So it's commonly described as a ringing sound, but it can be a buzzing, humming, a roaring, a whooshing, hissing, crickets, sizzling, and even music. And some people have clicking and popping. So any of those sounds can be considered tinnitus. It's just that general term that how we describe the perception of a sound that doesn't reside outside the ear. Tinnitus can come from, the most common cause is noise, also hearing loss, and it causes damage to the inner ear structures, and these structures can cause tinnitus. So when they're damaged, they can emit a sound. The hearing nerve can emit a sound, and there's also tinnitus can originate from the nerve of hearing or from other neurological origins. So taking care of your hearing not only helps preserve your ability to communicate and hear, but also helps prevent tinnitus, which definitely can preserve your quality of life. So on this next slide, so the chart at the top of this slide shows that a high-pitched hearing loss has greater effect as age goes up, and it's a pretty steep curve. So you can see the kind of your decades of age here, that the younger people are affected by high frequency hearing loss, high pitched hearing loss, like we were talking about. That damage happens in the higher frequencies first due to noise. And then as we age, the prevalence or the percentage of people affected goes up. And so due to all of the effects of life on our hearing, the more life we live, the higher chance we have of acquiring hearing loss. And we lose the high frequencies first, the high pitches, such that include consonant sounds, children's voices, bird song, whispers, and rustling leaves, for instance. The bottom of the slide shows how noise causes permanent damage to our hearing. So I have a video to share. Let's watch this video that gives us a better understanding of just how noise causes this damage.
Know that loud sounds can damage your hearing. But how does that really happen? Let's go inside the ear. Sound travels as a pressure wave. Louder sounds equal more pressure. The pressure wave causes mechanical vibration of the eardrum. The three bones behind the eardrum move together as a chain. This mechanical energy changes to hydraulic energy in the fluid-filled inner ear. It's here inside the cochlea that damage occurs most often. When sounds are too loud, the stereocilia break apart from one another. This can happen all at once or over years. This is what hearing damage looks like inside the ear.
So that's what it looks like in the ear of a video presentation, but here's what it looks like in a real ear. This is what it looks like inside the actual cochlea. This is an electron microscope image showing a healthy normal cochlea in the top, where the neat orderly lines are showing the stereocilia or hair cells. And we have these 3 lines of these outer hair cells and one nice, strong, solid line of the inner hair cells. And they're just looking beautiful and organized and orderly and healthy. So down in this bottom slide, however, these are hair cells that are damaged by noise exposure. They can't grow back and they can't be cured. So you can tell that this is a permanent hearing loss and permanent damage to the inner ear. So there's no order down here. Some hair cells are completely obliterated while some are partially intact and others are forming some semblance of their previous selves. When this damage occurs in the inner ear, it is permanent and there is no cure or surgery that can fix these hair cells or return them to their healthy status. So here's a chart to show you some examples of sounds and their decibel levels and how long before hearing damage happens. You can see some types of noise and their related noise levels here. Relatively common noise. Noise-induced hearing damage is related to the duration and volume or decibel level of the exposure. Government research suggests the safe exposure limit is 85 decibels for 8 hours a day. Some common decibel levels are on the chart. So if you use a blow dryer for daily personal use, you're safe. However, for our professional hairstylists, they are at risk for hearing damage, potentially being exposed to 90 decibels over 2 hours a day. In a more extreme example, if you attend a rock concert or any kind of amplified outdoor concert at Harvey's outdoor arena this summer, concerts can regularly exceed 105 decibels. And you see on this chart that it's actually showing 120. So sound exposure is safe for only minutes at either 105 or 120 decibels for sure. Some shows can be even louder, and these levels of sound usually last for long periods of time, 2 or 3 hours. So this clearly puts listeners at risk for hearing loss during a show. Many shows increase the volume level as the show goes on. So by the time the headliner is in full swing, the volume will peak out toward the top of this graph. And just to reiterate, hearing loss can happen in minutes if hearing is not protected at one of these amplified outdoor concerts. And I know we love them, so let me encourage you that I have good news in a couple of slides. So I know a lot of parents ask me, and even kids, but because their parents get on them, but they ask about personal earbud and earphone use. So we don't have to stop our teens from using their earbuds or earphones. Good luck with that. But we can encourage them to follow these rules of thumb that give us a practical way to monitor the volume. Thankfully, Apple products have alerts to let you know if you are listening at a level that is potentially damaging to your hearing. And hopefully more products will be doing that. Personal wearables will be doing that in the future. There are free sound level meter apps that show you the decibel levels of your surroundings and tell you what's safe and what is the danger zone. Sound Check Live by Sound Gear, this little picture that I posted right here, is one example that not only gives you a live decibel measurement in real time, it also informs the user of decibel levels of common sounds and the time limits of exposure before hearing damage can occur. And it's really helpful. It goes into some other information and it's a free app. It's a really nice little app. So it's also, we enjoy listening to our favorite song through our earbuds at maybe a little louder volume than we listen to our other songs or audiobooks or podcasts or anything. And so we're talking about these high volumes for prolonged sessions. And as you saw on the chart where it's kind of the safe time frame of these noise levels. So we're just looking at making sure that we're reducing the time that we're exposed to the louder amounts of noise that are kind of closed off in our ear with an earbud or headphones. So noise canceling headphones and earbuds may allow you to listen to music at lower volumes without ambient disturbances, but they have no controls to limit the noise level of the music. So they don't have any governors. They can go up pretty loud, and may not have a warning on them, about when you're at an extreme level. So, the rules of thumb for use for your earbuds, headphones, noise canceling, whatever, is to set the volume to where you can hear conversation around you. Maybe not with the noise canceling headphones, you are supposed to not hear that stuff around you, but with your normal earbuds or headphones. And if someone can hear your music from your headphones, it's too loud, so you should turn it down. And one very important note about noise canceling headphones is that they're not hearing protection. That's been it's been misunderstood by a few people that I've been in contact with, from a patient to other familiars. And so I just wanted to make sure you all are aware of that noise canceling headphones may sound like they're going to protect your hearing, but they're not noise protectors or noise hearing protective devices. So after seeing the ugly aftermath on the inner ear structures that we saw of those precious hair cells, I wanted to share this beautiful photo of a healthy cochlea that came from Johns Hopkins Medicine. And hopefully this inspires us to take care of our hearing. And just how do we do that? So we use earplugs and hearing protection. So prevention is absolutely the key. And the more we can prevent hearing loss, the less we have to treat hearing loss later on, and the less it's going to be contributing to those health risks that we talked about earlier, higher healthcare costs and everything. So some types of hearing loss we have no control over, of course, as we discussed, but when it comes to noise exposure, we have control. Noise exposure is the most modifiable risk factor that leads to losing your hearing. But now let's talk about hearing protection. There are 4 main types of hearing protective devices, or HPDs: earplugs, universal fit plugs, ear muffs, and custom earplugs. When a product is truly an HPD, there will be labeling on the packaging indicating the NRR, which is the noise reduction rating. This number is calculated in a laboratory for each HPD, and the EPA mandates the labeling of the NRR on the packaging. The higher the number, the more protection the HPD provides. Using the safe noise exposure times table in the previous slide, we can look at the or not exactly the previous, but 2 slides ago, we can look at the decibel level, subtract the NRR of the HPD used, and come up with the new permissible exposure time. So let's just go back to this one. So rock concert. So we all want to be able to attend our favorite rock concert at Harvey's this summer, or whatever your favorite venue is. So look at the rock concert. We have 120 decibels. Now you'll see in a few slides when I show you the earmuffs, for instance, but also foam earplugs. So let's just take an average of 30 decibels. So if there's a noise reduction rating on the packaging for a hearing protective device, that's 30. So we'll just take that 120 decibels at the rock concert. We're going to subtract 30, and we come up with 90 decibels. So 90 decibels is your new permissible exposure time of 2.5 hours. How long are concerts? Hopefully about 2.5 hours, at least at that 120 decibel level. Okay, so the first type of HPD or earplugs that we'll talk about are foam earplugs, and they're the most common, the most readily available, and economical and widely available hearing protective device. You can find them at your drugstore, but they're a one-time use HPD, so just remember you're going to toss them after you use them. The drawback is that most people are not using them properly. Adequately getting them into the ear canal will provide the protection they are designed to provide, and for the NRR noise reduction rating that they are given on the packaging. Some NRRs for foam plugs can be as high as 33, some in the mid-20s, and on average are 27 to 29 decibels. When inserted into the ear canal properly, they will be difficult to see from the outside. They will not be protruding in the bowl of the ear. They will be flush with the opening of the ear. So let's watch this video to learn how to maximize the effect of foam earplugs. And if the volume on this one is a little too low, just go ahead and feel free to turn it up on your computer screen yourself. I apologize if it's too soft for you, but it's not a hearing test, I promise.
How to use formable earplugs.
Oh, I'm sorry. Push the wrong button. Let's get back into that one. Apologize. Okay, we'll start that again.
How to use formable earplugs. Sounds can be harmful when they're loud and last for a while. The louder the sound, the quicker it can damage your hearing. The good news is you can use hearing protectors to keep your hearing healthy. These are formable earplugs. Formable earplugs are typically made of soft foam, are disposable, don't cost much, and are available in a variety of stores. For proper use, they will be inserted into the ear one at a time and one per ear. First, be sure your hands are clean. Then, roll the earplug up into a small, thin snake with your fingers. Use gentle pressure to roll the earplug, and then gradually increase pressure. You want to avoid making creases, which create tunnels that let in sound. Pull the top of your ear up and back with your opposite hand. This straightens out your ear canal so that the earplug is easier to insert. Continue to roll the earplug and gently slide the earplug into your ear canal so that it is flush with the opening of your ear. Insertion of the earplug should not hurt. If there is discomfort or pain, stop attempts at insertion. Gently hold the earplug in place with your finger. Count to 20 or 30 while the plug expands. Your voice should sound different to you, possibly louder and or muffled, when the plug makes a good seal. Check the fit to make sure your earplugs are comfortable and properly inserted. If it starts to expand out of your ear, it probably isn't inserted correctly. If this happens, take the earplug out and try again. Have a buddy look and see if you have inserted the earplug properly. Or use a mirror to check the fit. To remove the earplug, slowly twist or rock it to break the seal with the ear canal, and then pull it out of your ear. The best hearing protection is the type you are most comfortable wearing. There are many types to choose from. For more information about hearing and hearing loss, visit www.nidcd.nih.gov.
Right, it's so true. The one that's going to work best for you is the one that you use. So whatever that may be, just know to put it in properly. Okay, so the second type of earplugs are pre-molded or universal fit plugs. And they're tapered, made of flexible silicone, designed to be comfortable to wear and can be used multiple times. You can find this particular type that has these filters that are interchangeable or actually replaceable at your hearing care professional or audiologist's office. They are available for a variety of uses and needs with interchangeable filters, which provide clear sound while also protecting your hearing. So they will dampen the hearing, prevent you from getting hearing loss from noise exposure. They will help prevent with that, but they will actually let in enough sound, and that's what the filter is designed to do. They'll let in the sound to make it more clear, less muffled, get more of an equal frequency response coming through the earplug, which is great for especially musicians, but also just hearing conversation through the earplug when needed. They provide varying NRR or noise reduction ratings depending upon the decibel level of the noise. For example, music can be loud amplified music, intense rock concerts, or it can be a little bit less intense than that, but still damaging. So as you remember from the slide, it can be anywhere from 90 decibels all the way up to 120 decibels. So there can be different amounts of noise reduction or types of plugs and filters for that. Hunters need to hear most of the time, but not when they're actually shooting the rifle, for instance. So there are electronic plugs that actually take care of that automatically when the gunshot goes off. And that's super important because firearms can cause some damage really quickly. And preserves music sound quality, and that's what we all want, right? Allows the ear to breathe and having a comfortable fit. That's all really important, and being reusable. They can vary from like $40 to $80 depending on the intensity or the application. From work, music, hunting, motorsports. Think about those motorsports too. Motorcycles, snowmobiles, jet skis, all of that. All those fun things that we love to do. And we want to keep doing them, right? Okay, so the next HPD are earmuffs. And I took this, clipped this from Home Depot when I'm shopping on Home Depot. So a huge plus for these is that they're easy and quick to put on. And they sit right in place, in the right place, and properly protect your hearing every time. They are relatively affordable and last quite a long time. These, I believe, are just under $40, and they really do last a long time. You just want to make sure that this pad here does not start degrading. Otherwise, that's going to just not really give you the full NRR, which you can see here is 30 decibels, which is a really nice NRR. I tell my patients to put them beside the snow blower so they remember to put them on when they go outside to clear the snow or coming upon the lawnmower season, anything like that, any power tools, equipment like that. Even if you're hammering, just protect your ears. To prevent tinnitus is super helpful. And then of course we want to prevent hearing loss as well. And so the drawback is that they can be heavy. People see them. I mean, it's nice when you're using the chainsaw and you're cutting some wood and you just cut it and then, take them off, put them on when you need them. But you're not probably going to wear these to a concert. I've seen babies wearing these at concerts, and not that babies should go to concerts, but it's pretty, they're pretty cute. And they're not going to be so easy to use the foam plugs for. So there's, I guess, age applications as well for the earmuffs. And the fourth type of HPD are custom hearing protection. So these can be fabricated by an audiologist or hearing aid dispenser. They are for, as you can see, a multitude of applications, from music to keeping water out of your ears, which also in some cases work as really great earplugs as well. The Aquanaut is an excellent one with a pretty high NRR in the solid 29s. Filtered, concert, customs, motorsports. So just, and then there's even more. There's more that are, like we were talking about, the electronic ones that are made for hunters, as well as ones that help to pilots, for instance, to communicate, but protect their hearing from the ambient noise around them. They all have varying levels of NRR depending upon the type. And an audiologist makes custom ear impressions of your ears and ear canals and has that fabricated at a lab. And then they come back to the audiologist for fitting, and we make sure that they have a good fit. They actually have a remake warranty on them of about 3 months usually. So we have some time to make sure they're comfortable, make sure they are sealing out sound or water. The Aquanauts are a great application for people who are not supposed to get water in their ears due to any, medical recommendations, having ear tubes, for instance, or getting frequent swimmer's ear, as well as making sure surfers don't get worse surfer ear. They're made of flexible material to help keep them comfortable. They're washable and can be sanitized, and they can last for years. So they are worth the extra investment to have a custom fit that goes in the right way every time. As long as you insert them properly, but they're actually a bit easier to insert than the foam plugs. So what are some signs of hearing loss? How do you know if you're losing your hearing, or if you're experiencing early signs of hearing loss, or if you're susceptible to hearing loss? So sound is invisible, so sometimes it's difficult to tell what we're missing or that we're missing something. Sometimes our friends or loved ones will notice that we're missing something and they may make a comment to us. Hearing loss is insidious. It can be very slow to progress, and therefore it can sneak up on us. Our bodies are wonderful and adaptable, causing us to compensate for diminishing senses and abilities. So pay attention to the signs and the comments from your friends and loved ones, and be open to change. Don't deny it, so you can take action for your best overall health. So some signs are, asking to repeat frequently, increased difficulty hearing in noisy environments. That's, just that's so difficult for all of us. Even when our hearing is great, it's more difficult to hear in noise, but we adapt, we accommodate, we look at people's mouths, and subconsciously most of the time. Turning up the volume of your TV, radio, or phone to hear more clearly, or if you have some of the things that you should just be aware of and get your hearing tested is if you have a family history of hearing loss, if you've been exposed to noise or have a history of that, if you have tinnitus, ringing in the ears, or if you have any of the risk factors listed earlier in the presentation, you should get your hearing checked, even if you don't have any early signs. If you have these factors. And also just remembering some of those signs or some of those complaints that we talked about regarding mild hearing loss symptoms. Those are also some signs that you may be losing your hearing. So what can you do now? So getting your hearing evaluated would be the best thing to do now. Many of my patients tell me they haven't had a hearing exam since they were in grammar school. So everyone should have their hearing tested as an adult. Establishing a baseline is recommended. And of course, if you experience any symptoms of ear pain, drainage, fullness, tinnitus, dizziness or vertigo, or a sudden change in hearing, you will certainly be asking your doctor who would refer you for a hearing evaluation. And actually, we want to rule out medical conditions. So your doctor, if you have some of those symptoms I just mentioned, they would be referring you most likely to ENT and audiology, or just ENT first, and then we'd be determining if you needed a hearing exam. And when you're referred to audiology first, then I'm going to be determining if you need to see an ENT doctor regarding if there are any potential medical issues going on with your hearing. So otherwise, you should ask for a referral from your doctor for a hearing exam if you have been around noise, if you're asking people to repeat, if you're having trouble understanding conversation, if you have tinnitus, any of those symptoms. And establishing a baseline is a great idea. So having your hearing examined before you start having any symptoms is ideal. So we can see what's your hearing like when you're in a very healthy state and your hearing may be just fine, or we can just see any patterns and monitor them over time. And that's what we like about having baselines, to compare things to if something does go south. So key takeaways: prevention, detection, and intervention. So take action to protect your hearing, and prevention is the key to preserving your hearing and holding on to the precious sounds of life. As we discussed earlier, preventing hearing loss and treating hearing loss helps reduce healthcare utilization and reduces medical conditions, including cognitive decline. Don't take your hearing for granted. There is no miracle cure or magic bullet for hearing loss. When in doubt about the noise level, use hearing protection and establish a baseline for your hearing, and enjoy the sounds of life in moderation. Hearing loss, just remember, it can be permanent, so we want to prevent that as much as we can and take control over the modifiable factors in our lives. Intervention, of course, treatment, may be hearing aids, it may be other assistive devices, it may be medical intervention. So we just don't know until we do an exam and we find out and we discuss what we can do to work together toward your best hearing health and your best overall health. So taking care of your hearing is part of self-care, and better overall health and improved quality of life. So being proactive about preserving your hearing helps you stay connected to your loved ones and all the sounds of life. So please feel free to contact me at my email address here or at the ENT and Audiology Clinic phone number here if you have any questions or need any further information. And thank you so much for attending this webinar.
Thank you so much, Marina. That was amazing. We've had some questions come in already, and a couple people have raised their hands. We definitely can try to allow them to speak. I'm going to get to the written questions first, and then we can try to see if someone would rather ask via their Zoom mic. But the first question is asking if they are making their hearing loss worse the longer they prolong coming in to see you. When do you know it's time to come in for an evaluation? If you've noticed a limited amount of hearing loss in one ear, don't have pain, or it doesn't really affect everyday life.
Okay, yeah, anytime there's a change in hearing, I would suggest that is the time to get your hearing examined. Even if it's not affecting your hearing or your communication or your daily activities or interactions with other people, or if you don't even have any symptoms, it just any signs of changes in hearing are warning signs. So really need to, and it could be something that we can do something so easily about. You know, some people just get a plug of wax in their ear. We get that removed by the doctor, and then they hear better and things are great. So, you know, we always hope it's the simplest, and we start with the simplest solutions, and then we move forward to what else what do we need to look into? But evaluating is the first step for sure.
Great. The next question is asked, does repetitive pressure on the ear cause damage, like flying or going up and down the mountain pass?
No, it shouldn't, as long as the eustachian tube is functioning normally. And this is probably a better question for our ear, nose, and throat doctor, Mantegi. But generally, if our ears and our mechanics of our middle ears are equalizing pressure properly, going up and down the ski lift, going over the mountain passes, flying in an airplane should not have any effect upon our hearing permanently. I mean, maybe you can't clear your ears and you feel plugged up, but that eventually should clear. And if it doesn't, then you need to come in and see our ENT doctor.
Great. The next question asked, approximately how much does it cost to get the personalized earplugs made?
Oh, yeah, that's a great question. Yeah, the custom earplugs. So it depends on, because as you saw, there were so many different types, and some are more sophisticated, some are less sophisticated, but they start from out of pocket price here at Barton for about $150, $160, and they can go up to, for like musicians, plugs with the filters for varying listening levels, as could go up to closer to $300. And that's for a pair. Of course.
Wonderful. So there is still someone with a hand raised. I'm going to allow them to talk.
Okay.
And see, it's Sandra. I don't know if she's there or if she wants to ask a question. I'll give her just a minute. Otherwise, we'll go ahead and lower. And we'll go ahead. I don't think might have been a mistake, but if you did want to ask a question, go ahead and raise your hand again and I'll allow it. We did get another question. For those of us who have hearing loss, or ringing, do oral drops like Cortex work to help grow inner hair ear?
No, drops are not going to get into the inner hair cells. So the drops are just going to go into the ear canal, and the eardrum is going to be your barrier between your outer ear or ear canal, the opening to the ear from the outside, and that's the barrier between the to the middle ear, and then the inner ear is even beyond that. So the cochlea is very embedded, it's very protected, and drops do not affect the cochlea.
Okay, I'm not seeing any other questions, but I'm gonna go ahead and I'll kind of start to wrap things up. But if you do have a question, you can definitely ask, and I will go ahead and ask on your behalf. Oh, and it always happens when I start that and someone wants to ask. The next question is, can overuse of medications cause I'm not going to say it right. I want to say tinnitus, but that's not right.
Tinnitus. No, that's okay. You can say it either way, tinnitus or tinnitus. Yes, there are certain medications over the counter as well as prescription that do cause tinnitus or can make it worse. So there's quite a list of them that are that have that potential of having that as a side effect. So I'm not sure what medication you're particularly asking about, but definitely a lot of pain relievers. Definitely, we don't take a lot of aspirin, like literal aspirin anymore, but some people do because they can't take the other products like the Tylenols, the Aleve, the Motrins, the ibuprofens. But all of those in high excessive amounts can cause ototoxicity, which can lead to tinnitus and hearing loss.
All right.
That's a good
got-
question. Thank you for asking.
Yeah, that was a good one. And we've gotten a lot of thank yous. They've good information, especially with the decibel chart. So thank you for that.
And if anybody wants that, I mean, of course you can, probably print it out from the slides and everything, but if you feel like you want a copy of that, just reach out. We can provide that for you and not a problem.
Yes, if anyone wants me to send them the link directly for this recording or get a copy of Dr. Marina and Dr. Mulvey's webinar slides, I'm happy to send those over. And I don't see any other questions come through, but yeah, just a lot of thank yous. That's really nice.
Thank you all for coming.
I'll just wrap it up and then let you know that there is a survey at the conclusion of tonight's webinar. When you exit out, we would love your feedback. Let us know how we did tonight. If you have any topics that you'd like to hear from in the future. And as I did mention, this is available on our YouTube channel, and I'll also post it to our Facebook page shortly after we conclude. But yeah, I don't see any other questions. I think that means you covered it really well, and just appreciate your time tonight. And thank you everyone for attending. I hope you have a good rest of your evening.
Thank you. Good night, everyone.